Mental health, first aid and eating disorders. Eating disorders are severe mental illnesses that have an impact on a person's relationship with food and their body. They are frequently characterized by extreme behaviors and attitudes regarding food and weight, which can have serious consequences for physical and mental health. Eating disorders are classified into three main types: anorexia nervosa, bulimia nervosa, and binge eating disorder. Here are some examples of common signs and symptoms for each. Anorexia nervosa is defined by significant weight loss, inability to maintain a healthy body weight, anxiety about gaining weight, persistent worries about food, weight, and calories, and avoidance of eating in public. Bulimia nervosa is defined by binge eating followed by purging, such as vomiting or using laxatives to empty the bowels, along with feelings of guilt or shame about eating. Signs and symptoms include an obsession with weight and body form, dental issues as a result of regular vomiting, cheek or jaw swelling as a result of frequent vomiting and irregular menstruation periods. Binge eating disorder is defined by recurrent binge eating episodes, eating more quickly than usual and feeling a loss of control over eating during a binge. This can include eating until they're uncomfortably full, eating alone because they are embarrassed about how much food they ate, along with guilt or humiliation after a binge. Eating disorders are often treated with a combination of treatment, medication, and dietary counseling. Cognitive behavioral therapy, CBT, family-based therapy, and dialectical behavior therapy, DBT, are all common types of treatment. To treat symptoms such as depression or anxiety, medications may be provided. In addition to professional therapy, a person can do a number of things to control their eating disorder and support recovery. These may involve the following: learning about the condition and its impact on the body and mind, creating a positive relationship with food and learning to eat mindfully, practicing self-care and stress reduction practices, seeking help from loved ones and a mental health professional, maintaining contact with others and avoiding isolation, developing coping mechanisms for difficult situations and emotions. It's vital to note that eating disorders can be fatal if left untreated, so it's critical to seek help if you or someone you love has an eating disorder. People with eating disorders may sometimes be discreet about their illness. Among the most common explanations are guilt and humiliation. Eating disorders are frequently connected with emotions of guilt and embarrassment, which can lead to people hiding their issues to avoid judgment or criticism. Fear of losing control. Eating disorders can help individuals reclaim control of their lives. They may be hesitant to communicate their difficulties with others for fear of losing control. Stigma and misconceptions. There is still a lot of stigma associated with mental health concerns, especially eating disorders. Individuals may feel alienated and misunderstood as a result, driving them to conceal their difficulties. Denial. Some people who suffer from eating disorders may be unaware that they have an issue or may be in denial about the severity of their condition. This makes it difficult for individuals to seek assistance or communicate their difficulties with others. It is critical to remember that eating disorders are complicated mental health illnesses that are not the individual's fault. Individuals battling with an eating disorder must feel safe enough to open out and seek help in a supportive and non-judgmental atmosphere. Mental health first aid training can equip persons with the skills and knowledge needed to recognize the signs and symptoms of eating disorders and to support someone. Individuals who get MHFA training can learn how to approach and speak with someone who may be experiencing an eating disorder in a non-judgmental and helpful manner, as well as connect the person to appropriate resources and professional treatment. MHFA training can assist individuals in comprehending the intricacies of eating disorders, such as the impact of societal forces and personal experiences on body image and eating behaviors. Individuals who complete this course will be better equipped to support colleagues, relatives, or loved ones who are going through an eating disorder and will be able to receive the appropriate support and treatment to manage their illness. Thanks for watching. Like, share and subscribe. Check out Mental Health and Life for all your training needs.